How often should I replace my toothbrush? We throw out and replace expired milk, bread, and many other stuff with the new one. But when was the last time you replaced your toothbrush? We all know that brushing our teeth is an important part of maintaining good oral hygiene, but have you ever wondered how often you should replace your toothbrush? Fun fact, it is recommended by many dental experts to also replace your toothbrush after you had a flu, cold, or any other viral infection, as germs can linger on the bristle and lead to reinfection. To ensure that your toothbrush can maximize how much bacteria it can remove and make every toothbrushing session worth your time, you should learn when is the right time to replace your toothbrush. Unfortunately, it is not always easy to tell when you need to replace your toothbrush, but there are some common signs indicating that it is time for a new one. In this video, we will explore the importance of replacing your toothbrush, what happens if you don't replace your toothbrush, and how often you should replace your toothbrush. Why you should replace your toothbrush? It is widely known that regularly brushing your teeth is one of the most fundamental practices for maintaining good oral hygiene. However, what if your trusty old worn-out toothbrush is doing more harm than good? Here are two main reasons why you should replace your toothbrush. 1. Toothbrush bristle get worn down. As you use your toothbrush twice a day to brush your teeth, the bristle fiber are gradually worn down by the hard surface of your teeth, which can cause them to become rough and less effective at cleaning. 2. Too much bacteria accumulate on your toothbrush. The warm and moist environment on the bristle is an ideal breeding ground for bacteria. Even with regular rinsing, some bacteria can still linger on the bristle, leading to an excessive accumulation. Tip: rinse your toothbrush thoroughly with water after each use to minimize the amount of residual and bacteria that accumulate on the toothbrush bristle. Using a worn-out toothbrush will more effectively clean your teeth and gum, leaving behind harmful plaque and bacteria. As a result, this can lead to various oral health issues such as tooth decay, gum disease, and other oral health. Many studies also indicate that a new toothbrush can remove more plaque compared to a worn-out one. Therefore, when you begin brushing your teeth again, ask yourself if your toothbrush is working its hardest to help your teeth clean, or whether it is time to switch to a new one. Summary: it is important to replace your toothbrush regularly. Not only will it help remove plaque and bacteria more effectively, leaving your mouth cleaner and fresher, but more importantly, it reduces your risk of getting unnecessary oral problems like cavity or gum disease. When should you replace your toothbrush? When it comes to replacing your toothbrush, there isn't a strict rule about how often this should happen. The frequency of replacement depends on various factors, such as the type of toothbrush you use, how you store them, and how often you use them. Here are 5 signs that indicate you need to replace your toothbrush. 1. The bristle are worn out. One of the easiest ways to tell if it is time to replace your toothbrush is by looking at the bristle. If they are frayed, then it is time to replace your toothbrush. Worn-out bristle won't effectively clean your teeth and gum, leaving behind bacteria and plaque. 2. Discoloration or bad smell. If your toothbrush has a strange smell or change color, it is a sign that it had bacteria and needs to be replaced. You don't want to put harmful bacteria back into your mouth every time you brush, right? 3. After you've been sick. This is because bacteria and virus can linger on the bristle of your toothbrush, which can lead to reinfection. Therefore, make sure to replace your toothbrush once you have fully recovered to prevent reinfection. 4. After sharing your toothbrush. Sharing your toothbrush can lead to cross contamination. For example, if one person had gum disease, the bacteria responsible for those conditions can easily spread and accumulate on your toothbrush, so you should never share your toothbrush with anyone. 5. Every 3 months. Again, toothbrush bristles become frayed and worn out over time, making them less effective at cleaning plaque and bacteria from your teeth and gum. It is always better to be cautious and replace your toothbrush after 3 months to ensure you use a clean and effective toothbrush. Tip: if you're not using a particular toothbrush daily, for example, just on work trip, dentists also recommend you replace it every 6 months. If your toothbrush looks worn out, or its color is frayed, or turning darker than usual, it is time to get a new one. Don't worry, this doesn't mean that anything is wrong with you. It simply means that your toothbrush is no longer as effective at cleaning your teeth, and a new brush with fresh bristles will do a better job. Summary: you should pay particular attention to the bristles on your toothbrush. If the bristles on your toothbrush are worn out, fan out, or frayed, or especially if you see dark color change, which is a sign of mold, then it is time to replace it with a new one. Also, consider replacing to a new toothbrush sooner if someone in your house is sick or using your toothbrush, to prevent the bacteria from spreading. What happens if you don't replace your toothbrush often enough? Here's a fun, unhealthy fact. Cal Alberman, a New York City dentist, had said that many of his patients never change their toothbrush unless he hands them a new one. We just learned the reason and benefit of why we should have a fresh toothbrush regularly. But have you ever wondered what happens when the same toothbrush gets used for month after month? Here are some consequences of using the same toothbrush for extended periods of time. Unclean teeth. Worn out bristles can reach between teeth and become less effective at removing plaque and bacteria, leaving behind sticky film on your teeth. Bad breath. Besides unclean teeth, leaving plaque and bacteria behind can also lead to the buildup and cause bad breath. Cavity and gum disease. Due to food particles and bacteria not being properly removed, they can contribute to cavity and gum disease. Other oral health problems. The toothbrush bristle will also start to have bacteria and fungus living on it, which potentially increase the risk of oral infection. Maintaining good oral health goes beyond just brushing. Regularly replacing your toothbrush as recommended by dentists is important. By prioritizing your oral hygiene and ensuring your toothbrush is in optimal condition, you can maximize its effectiveness and prevent other risks and uninviting issues involved with not replacing your toothbrush. Summary: a toothbrush with worn bristle won't clean as well as the new one, and because of this, you're going to face the risk of unclean teeth, damaging your gum, or the increased risk of oral health problems. Yes, it can be even more serious than just a bad breath problem. How often should you replace your toothbrush? It depends. Studies have found that around 2 to 3 months is when the bristle breaks down and lose effectiveness. But how often you replace your toothbrush can vary and depend on a few factors. How often do you brush your teeth? What is your brushing technique? Easy or excessively hard? Do you use that toothbrush to brush your teeth twice a day or just on work trip? Do you use a manual or an electric toothbrush? And also, how often you should replace your toothbrush depends on how well you take care of it. Most dentists and the American Dental Association recommend replacing your toothbrush every 3 months, or even sooner if the bristles are frayed. Tip: from my experience, waiting for 3 months to replace your toothbrush could be too late. At that point, the bristles are probably frayed, and the effectiveness of removing bacteria from that toothbrush is decreasing. I recommend replacing your toothbrush every 2 months, to ensure the toothbrush is working its hardest to keep your teeth clean. And if you don't feel good about throwing away plastic toothbrush 4 to 5 times per year, I recommend you look into other options like bamboo toothbrush that will break down naturally. Summary: a toothbrush can physically last for a while, but that doesn't mean you should use it until it's falling apart. The American Dental Association recommends replacing your toothbrush every 3 months, or when the bristle becomes worn down or frayed, whichever comes first. Quick takeaway: with all the information provided in this video, it should be easy to figure out when you need to replace your old toothbrush. If you want to keep your teeth healthy and clean, the American Dental Association recommends replacing your toothbrush every 3 months, or sooner if the toothbrush bristle becomes frayed or matte. But wait, there's more. Brushing habit and how well you take care of the toothbrush can also influence the replacement frequency. If you brush aggressively or more frequently than twice a day, many dentists suggest replacing your toothbrush even more often, every 1 to 2 months, for optimal dental hygiene.